In the discussion of barriers to care access for people of color, our last shrink short addressed the lack of minorities on care teams and the effect of that shortage on communities of color. The second barrier to access is more personal, and it lives inside communities themselves. Stigma. This is Dr. James McKnight with another shrink short. For decades, conversations about mental illness in communities of color have been shaped by silence, shame, or the belief that struggles should be handled privately through faith, family, or sheer willpower rather than through professional treatment. Advocates have been working to reduce stigma in communities of color and encouraged those struggling with mental illness to seek help proactively. But has anything really changed? The honest answer is only partially, and the data is sobering. Compared to the general public, significantly more Black, Latino, and Asian American respondents saw conditions like depression and schizophrenia as not serious problems or believed they've improved on their own without treatment. And stigma isn't just an attitude, it shapes behavior. Nearly two-thirds of Black adults experience mental illness don't receive treatment, and Black adults remain less likely than white adults to get care even when reporting similar symptoms. 2023 federal survey data confirmed this pattern broadly. White and multiracial adults were more likely to receive mental health services than Black, Hispanic, or Asian adults. There are signs of progress. More community organizations, faith leaders, and campus groups are now actively working to open up the conversation. But researchers are clear. Awareness campaigns alone haven't closed the gap. Real change requires pairing stigma reduction efforts with workforce changes we just talked about. Because even when someone is ready to seek help, they may need a provider who looks like them, understands them, and is actually available. These two barriers, who provides care and how mental illness is perceived, aren't separate problems. They reinforce each other. A more diverse mental health workforce can help break down stigma from the inside. And as stigma decreases, more people seek care, creating demand for the very providers communities are working to train. Closing the gap means investing in both at once, building pipelines that bring people of color into the field, and supporting the community voices already working to make mental health care feel less like a last resort and more like basic care. This has been Dr. James McKnight with another Shrink Short.